Welcome back to the Weekend Report. I am Masachaba Mposwa. Now, the Universal Healthcare Access Coalition wants to see the recommendations of the health market inquiry implemented. The call comes in the wake of government's proposal to implement only minor selected recommendations to address the high prices in the sector. The coalition is a broad-based alliance representing the majority of the country's health professionals and funders. Dr. Mvuyisi Mzukwa, a member of the Universal Healthcare Access Coalition, joins me now. Good morning, Doctor. Welcome to Newzroom Africa.
Good morning to you, Masachaba, and to your viewers, and thanks for having me in your program.
Now, firstly, Dr. Mzukwa, can you start by sharing your thoughts on the government's recent proposal to address high healthcare costs in South Africa?
Okay. We think that there are other challenges, that has been brought up by this partial implementations of the HMI recommendations. I think first we need to start with the fact that really, if you look at it, it lacks the legal foundation, in the existing legislation. That's the first thing. Also, we feel that it really oversteps the Competition Act by introducing a price regulation. But also, it then assigns inappropriate functions to the multilateral negotiating forum, such as, for example, the setting of quality standards, that is very technical. Treatment protocols, it needs very technical issues. And formularies that are generated out of that. But also, we believe that it is a politicized governance structure, and we think that compromises the independence of that structure. Maybe let me quickly go through what we think is a problem with that. If you look at the tariff governing body, for example, it is effectively a political appointed structure. It raises concerns with the conflict of interest, But also there's no clear criteria on the multilateral negotiating forum, in terms of how do you select them? Do you say, because Mzukwa, we don't agree with him on NHI, pack him aside, we are not going to invite him in these negotiations? Where is the independence? But also, looking at the decision making, we don't see where the consensus is defined. For example, what is consensus? Is it 60% of those that are in the negotiating forum, or is it 100%? But also, there is absolutely no dispute resolution mechanism. I think that's where the problem is. And you look at the structure as well. It is voluntary. You can't have a voluntary structure in this case. It must be binding. It must be compulsory for people to come into these negotiations, so that you don't find people saying, I was never part of that, and I don't want to be part of that, and I will continue with my pricing. So if you make it voluntary, it still becomes a problem. But the last part, I think, that I need to bring to your attention is the fact that it only addresses tariffs, by practitioners. It does not talk about tariffs. It excludes hospitals, which is a key cost driver. So you are just attending to one small aspect of practitioners, but you forget about the value chain, regarding the cost of medicines. Because if we're going to be talking about costs, it has to be holistic. Yeah. You must talk about the cost of the doctor, the cost of medicines, and the cost of hospitalization.
Let's talk more about the cost, Doctor. What is driving up the cost of healthcare in South Africa?
Well, if you look at, if you have seen the analysis of the costs, most of the costs are in the hospitals. Whether it in theaters or in admissions and stuff like that, because our system, as you know, is hospital-centric. And if you look, for example, at the GPs, I mean, they're getting about 11% of the whole pie. So if you address just, those little aspects of talking to the tariffs of practitioners, then you have missed the boat, because you have excluded the part that really drives the costs.
Now, why do you think that the government's plan, firstly, to control healthcare costs won't work?
Yeah, if you look at this, Mzukwa, the health market inquiry specifically speaks to the issue, of tariff negotiations, because it says that, for example, it says our recommendation, that is the market inquiry. It says our recommendations focus on the key interventions necessary to correct competitive distortion, improve access to and increase the affordability of private healthcare. Then they say the interventions which we recommend should be viewed as an integrated whole, and market failures may persist if a partial approach to the implementation of the recommendation is adopted, which speaks to what we are raising now. It is the market inquiry that spoke to speaks like this. And then, it raises the question that we are raising to say, if you are coming with a partial approach, then you have missed the boat again. So if that would, you get that from the HMI report that in 2019 of page 210.
All right. And do you think that private healthcare providers and medical schemes are indeed committed to working toward universal healthcare access, or are their interests primarily focused on their own sustainability?
Well, it is. I think we have agreed, all of us, in terms of universal access. All of us agree that the private healthcare system is costly. It needs to be regulated. And I think there's no disagreement around it. But we always have to talk about the how. When we come up with, remedies to these issues, we need to be holistic, as it is recommended by the health market inquiry. So you can't be leaving one aspect and coming up with the other aspect. You are not doing anything. It's not going to do a dent in terms of the cost. If you leave other aspects of the cost in the system, that's what we are raising.
So what should the government do to make healthcare more affordable? And I mean, are there any steps or actions that you'd like to see the government take, healthcare providers or individuals, to address the challenges around the healthcare system?
Well, as I pointed out, there are issues that we have raised there, and we then think that there are issues that needs to be attended to. There must be a properly legislated multilateral negotiating forum, but also there must be a creation of a supply side regulator for health. But also, like I raised to you now, there must be the integration of hospital pricing reforms. You can't leave them out of the system, because they are also one of the cost drivers, biggest cost drivers, by the way. And also the establishment of a risk equalization mechanism. So there should be that clear implementation pathways in terms of, if there is no consensus, what is the next step? What is the dispute resolution mechanism? So those are the issues that I think it's really important for government to consider this. I'm not sure if the technocrats in the Department of Health has really thought about these issues when they came up with this gazette.
All right. Thank you so much for your time, Doctor.
Thank you so much. Thanks. Bye.
And that was Dr. Mvuyisi Mzukwa, a member of the Universal Healthcare Access